Hello, and welcome to the 6th event in the Meadows Mental Health Policy Institute Speaker Series, all about implementation science. I am Tegan Henke, Senior Director of Program Implementation for the Child and Family Policy team at the Meadows Institute. As a reminder, the Meadows Institute is an organization focused on helping Texas to be a national leader in treating all people with mental health needs by providing nonpartisan, data-driven, and trusted policy and program guidance. We know you're all busy, and we're so grateful that you took the time to join us here today. If you're new to this 8-part speaker series, so far we've had experts share knowledge on implementation science topics. We've talked about ways to use data to meet your organization's needs, how to select the right evidence-based practice, cultural humility and how it supports health equity, and ways to address childhood trauma and grief to promote child and family resilience. If you'd like to watch or rewatch any of the previous webinars, those recordings can be viewed on our website. And today's session will be recorded and will be posted on our website within a few days as well. Today's session will be 55 minutes and in webinar format. During the session, if you have an audio or a tech issue, please use the chat box and a member from our team will help provide support. Before I introduce today's speakers, we'd like to get a sense of who is in the audience. You'll see a poll pop up on your screen. Please let us know which option best describes your current role. And please know that our speakers are adjusting their presentations at this precise moment based on your responses to this poll. We've got a couple of pros here today. All right. The results are still coming in. All right. Speakers, take note. It looks like we've got a pretty diverse audience. All right. One last thing to remind you that our speakers will be taking questions at the end of the webinar, but throughout the webinar, you can submit questions using the chat or the Q&A function, and I will keep track of them. Okay, on to the main event. For the first part of today's discussion, we welcome Melissa Rowan, Executive Vice President for Policy Implementation at the Meadows Institute. Melissa brings a practical, real-world focus to the Meadows Institute's work by taking our policy and best practice strategies to partners at the state level and to communities across Texas to innovate and improve the delivery of mental health care. Previously, Melissa was a partner at Wirtz & Rowan, a healthcare policy consulting firm she founded in Austin. She also served as healthcare policy director for the Texas Council of Community Centers, working on innovation and design of behavioral health programs for adults and children. She was appointed to the boards of the TMF Health Quality Institute and LifeWorks and served as vice chair of the Texas Health and Human Service Commission's Behavioral Health Integration Advisory Committee. Whew, that was a mouthful. She earned her MSW from the University of Texas at Austin and an MBA from Concordia University. Welcome, Melissa. We're so happy to have you here. So with that, I will turn it all over to you.
Great. Thank you, Tegan, for such a nice introduction, and welcome everyone. I think on our online poll, we should have said, are you a Longhorn or an Aggie or a Sooner, some things like that too, but we'll go with what Tegan's already asked. I noticed there's no one on the in the webinar that identifies themselves as a billing person. So I thought that'll be interesting as we talk about billing opportunities and financing of healthcare. So this will be a very high level discussion. So it's okay if you're not a finance person. I think really part of it is understanding what the opportunities are and whether or not it's something that you want to look into in more detail. So why does it matter? I think for all of you, every dollar matters in the work that we do. And the opportunity to receive reimbursement from insurers for services provided helps you to increase the capacity of what you can do. Funders want to know that you're efficient and effective and that you're maximizing your financial opportunities. So I think there's a lot more talk. And Cindy can say something about this when she talks about philanthropy, but there seems to be a lot more discussion in the philanthropic world around, are we making sure that providers are billing when they can bill? And if you collect insurance revenue, you can use philanthropic dollars for other things, which is great. Next slide. So I think most people have a clear understanding about maximizing revenue, but a lot of times nonprofits aren't billing. So why aren't we billing? I think there's some fundamental issues that exist. Number one, there's a lack of understanding of how to bill and where to find training resources for help. And so it's not a simple thing to do. And I think most people know that. And so where to even go to get help can be difficult. If you're a small nonprofit, billing can be hard in a healthcare billing environment that's really designed for much larger groups. It's one of the reasons why as healthcare financing has become more complicated, a lot of physicians have joined large groups so that there's someone who takes care of that piece for them. Financial systems and monitoring is very different for grants than it is for reimbursement. And it's a lot to learn with limited staff time. So none of these are small issues, but they can be worked through for most organizations. Next slide. I thought it might be interesting. I was involved at the St. David's Foundation in Central Texas, funded a 2-year Medicaid capacity building academy in which grantees could apply to participate in the academy that were interested in becoming a Medicaid provider and billing for Medicaid services. And this is one of the areas where, a philanthropic organization was really wanting to encourage their nonprofits to bill, but they also didn't want them to ask them to do something they didn't know how to do. And so when we asked in the beginning of the academy, what are your biggest concerns or challenges? These are things that we heard the most often. People didn't know how to become a Medicaid provider. They were concerned about contracting and credentialing with managed care organizations. They weren't sure how to verify insurance or when they'd have to receive authorizations. The billing requirements and the forms were unfamiliar. For those that were trying to bill or had been billing, they had problems tracking denials and appeals and didn't know what kind of financial management or reporting to be using. And then all of them had concerns about the implications of moving from grant funding to Medicaid, because the Medicaid rates in Texas have been known historically and continues to this day to be lower. And so what if they switch to billing and then the grant funding used to pay them $100 and the Medicaid rate's going to pay them $60. And so there was a lot of concern about that. One of the things that St. David's Foundation kind of, agreed to in the beginning of the academy was that we're not going to take away your grant funding. If we find out you can bill $100, we're not going to take $100 away from you. We're going to talk about how to repurpose that. And so I think that made it much easier for people to be willing to try this out. In this group, at the end of the 2-year capacity building academy, billing revenue was significantly increased for all the participants except for one. And there was one nonprofit involved in the academy that when we got through all of the work to figure out if it's appropriate to bill, they had barriers that they could not overcome. But now they can explain that to funders so they understand why they can't bill, which helped them tremendously. So on this next slide, you can see just some basics on revenue cycle management and what all goes into actually becoming an organization that bills insurers. And I think the most important part of this is that the process involves the entire organization, not just the reimbursement department. So whoever's doing your scheduling, who's going to verify insurance, the service delivery itself, the service documentation, contracting and getting credentialed, confirm, systems configuration, staff training, all of these things go in and need to be understood before you actually drop a claim to an insurance company. And so this is a kind of a general concept that I was just going to throw out today without going into a lot of detail. And this is a general revenue cycle management process, but Medicaid and each insurance company that you deal with may be slightly different. So in Texas Medicaid, there is a process that you have to go through to be able to get paid before you can bill one of the insurance companies or the state, because we have both claims payment at the state, but we also have contracts out to insurers. And so you have to apply and receive a provider number. They require you to enroll as a Medicare provider first, unless you have an exemption because you're only serving children. And then you enroll as a Medicaid provider, and then you have to contract with each insurance company that is paying for Medicaid services in your area, and then get credentialed with them. And then once you're in that place with contracting and credentialing complete, you can start service provision for their members. And so that may require prior authorization depending on the insurance company. And then you provide the service and then move into claims processing. I think both this slide and the revenue cycle management slide gives you a sense that there are a lot of pieces to think about. That's more than just billing. I think sometimes people think you just drop a claim, and there's more to it than that. But it is something that you can learn. You learned how to, respond to all the requirements that a grant requires you to report on. This is just another area that requires learning and knowledge. When you are for billing insurance companies, there's some key performance indicators. This is just a sample dashboard of some of the financial metrics that you would be tracking around days in accounts receivable, the net collection rate, the denial rate, how long it takes you, the claim lag, how long it takes you from the time you deliver the service to send out the claim. And there are industry standards and benchmarks for all of these things. And so this is a way to measure how successful you're being in your insurance collections. If it's something that you do today already, this is a good way to look at how you're doing compared to what would be considered good performance on these metrics. Who should bill insurance is a good question. And I think it's important to bill, but not every organization is going to be able to bill for different reasons. So I think don't start billing without due diligence. One of the things I have seen is organizations that don't really understand the revenue cycle or do not understand the requirements from the payers. For example, service documentation, what has to be in the documentation if you were to be audited. This is, that's if you collect revenue and then you're audited and you haven't done things correctly, they will recoup that money. And for a nonprofit, that particularly if you're smaller, can be detrimental to your financial status. So don't just start billing. That's the first thing I would say. You don't just start billing because you feel like you should. You really have to do your homework first and understand how to do it correctly. And then be able to justify your decision to bill or not to bill. So I think with philanthropy, you do need to have gone through a process to be able to explain why you're choosing not to bill for services that appear to be covered by insurance. Because I do think philanthropic funders really want to understand what's possible and what's not possible. So it's not a judgment on whether or not you've tried hard enough, but that you've looked to understand how you might go about this or not. And so I think it's important for every nonprofit to assess if insurance billing is right for you. So on the next slide, I thought maybe just to leave you today, as you know, this is a very high level discussion, but what are some of the key questions in that decision-making process? So I think the first one is, who do you serve? What are the ages? How many people that you serve are insured, and what type of insurance do they have? And how many people do you serve that are not insured? A lot of times, nonprofits that do not bill insurance don't ask these questions, so they don't actually know. So we've done some work where we had people ask for a month or two and get basic information from people. Some people knew if you were insured or uninsured, but they didn't know the type of insurance, things like that. But really to know whether or not the return on your investment, because you will have to invest on an administrative structure that can support appropriate billing, you need to know what's the likelihood of how much revenue you can bring in. And unless you know the insurance status of the individuals you serve, that's impossible to do. The next question is, what do you do? So list out your services with clear definitions of what that is. A lot of times providers, for example, think we do case management, and Medicaid pays for case management. Well, Medicaid pays for very specific types of case management. And so understanding it might be language that you use in your organization, but how do you define what that service is? Because that definition may not match the language that an insurer is using. And then what are the credentials of the staff delivering that service? There are always requirements for the type of licensure or certification that a person has to have in order to bill a service. And so you'd want to look at both of those. Are the services billable? So there are a lot of very important things that get done in the mental health world that are not billable services. But understanding if your services are billable or not billable helps you to make the case for whether or not you should be billing. To have some idea, what will you be paid through insurance? So to understand, you can, for example, in Medicaid, look at the fee-for-service rates that the state pays. It doesn't mean that's what your contract would be with an insurer, but it would give you some idea. There's also a source you can go to that shows for certain codes what is being paid for on average by commercial insurance in your area. So there's information out there that you can use to do a solid financial pro forma on what the likelihood is that you would collect through insurance billing. And then what does it cost you to bill? So what kind of staff do you need? Who do you have that knows how to do this today? What might you need that you don't have? Do you do that in-house or do you outsource it? What's the cost of that? And then it's pretty simple math. Once you do the hard math, which is the first set of the questions, is are you going to bring in more revenue than it's going to cost you to do the functions required? And if the answer to that is yes, then that's something you'd want to move forward with. If the answer to that is no, then you've at least done the due diligence to understand why you're not choosing to bill. And when a grant maker asks you that question, you can present the information in a way that's clear to them that you have looked at this seriously and that it is not the right thing for your organization. So if the answer to this is yes, and it is a financial gain to bill, then you really need to think about what do you need to learn and how do you learn that before you start so that you do it right from the beginning. And I would say, and having worked with several nonprofit organizations that had started billing, it was harder for them to backtrack and make changes than for people who were starting from scratch and didn't have a lot of stuff to clean up. The cleanup can be done, but if you haven't started yet, make sure that you learn the things you need to learn before you move forward with it. So I know that's a lot to cover in a short amount of time, and I think we're going to take questions at the end. And so I'm happy to, have more discussion and when we get to the place when that's a workable thing. Tegan?
Yeah, thank you, Melissa. I know I was writing down a bunch of questions, so at minimum, I will have a lot of questions for you at the end. So this is great.
Okay.
And I think our audience probably has questions too. So I invite you to submit your questions and I will hold on to them and we can ask them at the end as well. But for the second part of our webinar, I'd like to introduce Cindy Patrick, who's the Vice President of Development Partnerships at the Meadows Institute. Prior to joining the Meadows Institute, Cindy served as a Senior Program Officer for the Meadows Foundation for over 21 years. She analyzed grant proposals from nonprofits and public entities throughout Texas, primarily in the areas of mental health, substance use, and criminal justice and abuse prevention. Cindy was instrumental in the development and implementation of the Meadows Foundation's mental health strategic plan that created and supports the Meadows Institute. She has also led philanthropic groups interested in supporting effective behavioral health and child welfare programming. Cindy earned her MBA from the University of Texas at Austin. Thank you so much for being here with us today, Cindy. I always learn something in my conversations with you, so I'm excited to hear what you'll share with us today and really excited for the question and answer period afterwards. So with that, I'll let you take it away.
Well, thanks, Tegan, and good afternoon, everyone. Very happy to be here. And I must say, Melissa really set up the next segment of the talk here, because almost everything that she said there are aspects there that funders do look for to see if agencies have even considered billing. And I'll get into that a little bit in the future of this presentation. So first, I thought I'd go over a little bit of philosophy of what philanthropy and fundraising is all about. Basically, what philanthropy or philanthropic organizations like foundations, United Ways, different types of charitable trusts, what they're really looking for is to fund good projects. They know there are a lot of good people and good agencies out there doing good things, and they're looking for where can they invest their dollars into the most effective and the agencies that serve the people in a way that's very has good outcomes. So they start with that. And there's also the knowledge that foundations, despite how big they are or how little they are, such as the Meadows Foundation is considered a big foundation, really the number of dollars they have to invest in community projects is limited compared to something like being able to get reimbursed through Medicaid or some sort of insurance product. They also know that foundations have boards, and the boards are the ones that truly decide which projects to fund. And so the due diligence involved includes, has the agency thought about billing for these types of things? If not, why not? In all of the questions and the different types of analysis that Melissa suggested are good ways to answer those questions. It also sets up the fact that if it is, for example, you need to credential staff differently, you need to maybe set up a billing department, you need to do a feasibility study. There are many grant makers out there that would really like to help you do that, because they know that in the long run, foundation dollars can't fund a project for many, many years. At the most, it can be 3 to 5 years. Many only fund 1 year to help you set up, with the knowledge that you are setting up a program that can sustain itself to a point in the future. So basically, a lot of what I'm going to discuss here is what Melissa discussed, but more on how would you prepare and to know whether you should approach a certain funding source in the philanthropic world for your project. I think the fact that many of you have attended either all or some of these implementation science webinars definitely helps with the analysis of what is it we do now, what is our situation as an agency, who do we serve, how do we serve them, how do we measure whether our services are being effective, and the things that we have learned during this session of implementation science, and also looking at the different types of criteria of evidence-based practices. How will those enhance what we do? And what are the resources we need to implement those? Where are we at now? Where do we want to be? And how do we get there? A plan on how you actually address those types of things. Also, how do you ensure that you're going to stay with the models that you choose to implement? What will be the process you have to do? Do you have to change the way the forms you use, the different types of processes, the staffing you have in different types of things? Do you want to train all of your staff in trauma-informed practices? All these types of things are important in analyzing your situation, determining what exactly would we ask a foundation or a philanthropic group to fund. And that really helps in the proposal process. So this really gets to a very concise statement of what do you need, How are you going to deliver the service, and what kind of additional resources do you need? Sometimes it's technical assistance, contracting someone to do a study for you or to help set up things. Sometimes it's hiring staff, just getting that initial staffing up there. Sometimes it's new computer systems. It really depends, and depends upon what it is that you really need. That's when you go and research what kind of philanthropic sources can actually fund those needs. One group where this was a kind of a combo of the Foundation Center and GuideStar is candid.org, CANDID.org. That is a good place to start researching where you are, what is your location, what is it that you're looking for funding for, and it'll list a bunch of different foundation sources, different types of funding sources you can go to. Next slide, please. So in your application, once you figure out who it is you want to approach, and I do want to emphasize too, it's not just foundations that you may know of in the area. It's also civic groups. You might want to have fundraisers, like a fundraising event. You might want to have a mail out or an email virtual fundraising type situation where you say, we are really going to serve our clients really well. We want to enhance our services by doing this evidence-based practice. In order to do this, we need X, Y, Z. And to do that, we need X number of dollars. So that is the first thing you want to do. For a foundation application, if you're going to go on to a foundation's portal to submit an application, some still accept applications by computer, different types of application formats. The first thing you want to do is make it easy to understand. There are many, many foundations out there that really this funding in the mental health arena for children or any sort of evidence-based practices is one of many different types of things they fund. So you want to kind of realize that acronyms may not be fully understood by a foundation staff. Some of the terminology that you commonly use in your fields may not be easy to understand by foundation staff. I have in my past with the Meadows Foundation actually had several organizations that sent me an application full of acronyms. So I listed all the acronyms and sent back a question, could you please define what these acronyms are for me? The longer I was in the field, the more I understood the acronyms, but you can't assume that all foundation staff are going to understand what you're saying. So first of all, make it easy to understand, like you're talking to your neighbor who really doesn't have any idea what you do. Help us understand what it is that you do and what it is you want to do. Sustainability, big issue. So that's what I was saying, how Melissa was talking so much about that. If you are providing a clinical type service that could be reimbursed by any sort of insurance product, public or private, it is important for foundations to know that I know we can get you started, but we can't keep you going. How are you going to keep it going? So a kind of a plan, you have thought through that plan. Sometimes people say, well, we'll keep applying to other foundations. But we know in the foundation world, that's a difficult road to travel, because many times foundations are in the same boat. They just can't fund things they really want to fund every single year they'd like to fund them. So it's thinking about that sustainability issue. And if you've seen that billing is really not advantageous because of the clientele you serve or different types of aspects of what you do, then you want to be able to explain that very succinctly. This is the reason why we have decided billing is not for us. We went through this process and we decided for this reason and that reason, billing is not for us at this time. Also look at how you could fill gaps. If you are deciding to bill, and maybe you do have a funding resource within the agency to be able to get the staff needed to redo some of your coding situations, to do different types of things, what are the other things you need? Do you need maybe building renovation? to make sure that you're abiding by all the qualifications in order to bill or do whatever you need. So look at foundations to fill gaps. A lot of foundations are smaller. They may have only one staff member or a couple staff members, and the money they have is not a large substantial amount for a grant, but they want to help you. So this is one way to help, is finding something that funding a small dollar amount could help you fund. And then capacity building is what I stated kind of at the beginning of this talk, is that if you see that you do want to build, but you're lacking certain things like staffing, you need to do a feasibility study. We call that in the foundation world capacity building, helping you do those things, upgrade your computers, do different types of things. Next slide, please. And then, of course, we always want to encourage individual donors in many circumstances when you're looking to get started, or you need to supplement some of your reimbursable type situations. Individual donors that offer funding to assist your agency is a good place to find funding for that. Campaigns, looking at different types of ways that you can raise unrestricted dollars. They're called. They're not applied to any certain thing, and that is a decision agency-wide that your agency needs to make. Are we willing to put our unrestricted dollars towards getting our evidence-based practices upgraded, doable, have the staff, have all the equipment and things that we need? That's also another funding resource. Next slide, please. And then lastly, I wanted to talk about the influence philanthropy can have to help you with some of the barriers you may encounter. For example, if you're finding that there is a policy, whether it's local in the community or statewide, that maybe is keeping rates down, or there's something that's a barrier, let philanthropists know that this is an issue, that really you're doing all you can, but because of certain regulations, you just can't advance, or you just can't be able, you're having difficulty implementing something to its full fidelity because of this. And involve them in philanthropists can't really go to a policymaker and say, we want this different bill to pass, but they can say, well, we've heard from many providers that this policy or this regulation has really put a huge barrier in their way. And if something could just change to loosen up this type of policy or this type of restriction, there are many more organizations that could implement much better practices. So just remember, philanthropists want to help. You can help them help you in the policy and regulation area, because a lot of times philanthropists just don't really know what your barriers are and don't even think that it could be a structural issue caused by a policy or restriction, regulation that could be changed with a little bit of help. The last thing I wanted to really mention was the fact that many organizations, especially if you're part of a small group of service providers that serve similar types of populations in different parts of the community, or serve different aspects of the population needs, a collaborative effort could be formed. If you want to maybe collaborate and figure out how you could all build together in some way through a collaborative structure or some sort of coordinated structure, philanthropists love that kind of thing. So think about, would you want to coordinate with one or two other agencies to maybe collaborate together, submit a collaborative application to different funders about hiring billing staff or credentialing training programs for your existing staff, anything like that. And funders really enjoy seeing that you're trying to utilize your resources as efficiently as you can by collaborating together. So I hope there are many, many foundations in the Dallas-Fort Worth area. Many of them are interested in helping you and other service providers across the region provide the most effective services you can, because we know you're working hard to do so. So please ask questions. I'm seeing a few little things down there in the chat in the Q&A, and I think this is the time, Q&A time.
It is. Thank you, Cindy. That was really great. We've got some great questions coming in for both you and Melissa. So I'll invite Melissa to come back on, and we'll tackle some of these questions. So one of the first ones, Melissa, was about the Medicaid Academy that you mentioned, saying that it sounds so valuable. Is there anything like that that's currently available or in the works across the state? And what else might nonprofits and government entities like juvenile probation departments be able to do to get some help to start billing?
There's actually still an ongoing effort on the St. David's Foundation work. So after the 2 years, one of the things that the group decided together was that they wanted to look at the potential for having a billing consortium and potentially even a shared billing entity. And so that work is continuing. And because they are now looking at that, St. David's has allowed other nonprofits to come in and get help just basically assessing whether or not maybe billing is right for them. But that's you have to be a St. David's Foundation grantee for that. I think that other places where I've seen collaboration work well, and it's harder for nonprofits in my experience, but is when you have a good trade association. So the Texas Council of Community Centers really helps the local mental health and IDD authorities on when they moved to Medicaid billing, in the late 90s and early 2000s. And there are the FQHCs have a trade association that are constantly sending out information about changes in rules and reimbursement. Unfortunately, most nonprofits don't have that trade association but I think you can build and mirror that by people who have like-minded services and are doing some of the same things. How do you understand the possibility of sharing some of the responsibility for what you need to learn? So I think there are ways to do it, but it's not that it's ready-made out there unless there's someone who would be willing to fund an academy like St. David's Foundation did.
That's what I was wondering. So it sounds like St. David's really drove this academy. This is their idea, and they wanted providers to be part of it. And Cindy, you mentioned collaboration. And so I'm wondering, would it be reasonable for a group of providers who are interested in doing some sort of academy or being part of an academy to kind of partner in an application to get something like that funded if it were, in the North Texas area, just because we're here, but
Yeah, I think that's a very innovative idea, and I think that would be well received. There are groups, of course, funders talk to each other, and it would be something we would shop around to different types of funders to see if there could be enough funding gathered to be able to do an academy like that. I think the interest coming from the nonprofit sector, and especially those that have participated in this webinar and have learned the value and know the value of evidence-based practices and implementation science, that sets the stage for the next step, which would be great.
The takeaway that I got from both of you was really this piece about understanding why you're maybe not billing for a service. So it's not necessarily, a bad thing if you're not billing for every service that you're offering, but really just this understanding of why are you asking for support for this, to support what it is that you're doing. So, you may bill for some services, but not for all of them. And then you can seek that support, and maybe the audience would be the foundation audience or philanthropic audience would be more receptive if you've gone through this sort of exercise of understanding why your organization is choosing or not able to bill for certain services.
Yes. It's the situation where I know in my early days would ask, can you bill for these types of situations? And the response would usually be very general. Well, have the staff, we don't have, but you could tell from the response that it was primarily, we know billing is difficult. It's very difficult. It's the specifics of exactly what you would need in order to do that, and where you are as an agency right now, and what the barriers are to be able to do that. Some are relatively new, very small budget. It's very hard to even think about hiring the credentialed staff needed to be able to bill, or even putting processes in place. And as Melissa went through a lot of the issue areas there, it's that you do have to have an agreement with every managed care organization. And that can be very ominous when you're only maybe a 5-person, 10-person agency. So that it's mainly helping, it's part of the education of the philanthropic world too. There are some foundations that are very health focused. That is their full mission, is to fund in the health world. There are other foundations, and the majority in the state are very general, and they fund a lot of different things. So it's hard to know something about everything that you fund. So it's part of helping educate the philanthropists of what the reality is. And that's also leading up to, well, why do MCOs all require different credentialing and different types of things? I mean, that's kind of like, well, does that need to happen? Is there a change that should happen in the future? And I know that's a really long and hard thing to do, but you know, it helps philanthropists learn more about some of these barriers where it just seems easy. Why don't you just bill? You know, and it's not, it's complicated. And I learned after a period of talking with not only Melissa, but lots of other nonprofits about these things that you have to do in order to be able to bill.
Yeah, indeed. One of the great questions that we got is about, so what do you do? I'm reading it directly here. What if you do know of a way to sustain the program, but need the grant to build capacity to qualify for other funding? So you can't guarantee sustained funding. Do y'all have any thoughts about that? I thought that was a really great question.
Well, I'll start. That's what we consider capacity. I think in the world of social services and nonprofits and clinical services, it is a world of change. Everyone's out to make change, and when change happens, things aren't stable, and they're not always known. So it's taking a risk, but it's taking a calculated risk. So a capacity building grant to help you gain the ability to apply for other funding is a risk for the foundation or the funder who's going to do that for you. But it's calculated because you have done the situation analysis, you have done the decision-making analysis, and you can show we have done the due diligence to make this work. Will things happen and it not work? Yes. I mean, that's the way of the world. But you have done everything you can to make it a calculated risk instead of, well, we really want to do it, just fund us so that we can do what we want to do. There's a whole big difference there, and funders recognize the effort.
And I would just add, I think that particularly if you're asking for capacity building around things like billing, which is not inspiring to people, is that you be able to talk about it in pre and post. So this is how much money we collected in revenue before. Then we learned these things and we brought on these staff, and this is how much revenue we collected since then. And that's how many more people we can serve. And this is the quality of care that we were able to deliver, so that it, instead of people's eyes glazing over because you're talking about revenue cycle management, which you'll get really excited about, but no one else will care, is that those dollars translate into the services, the things that people do want to hear about. It's about more access to the services that you provide. It's about better quality of care. You know, all of those kinds of things are directly tied to how much money you have, in a lot of ways. But sometimes I think, depending on the foundation or the funder, how much they understand that, you may have to make that tie for them. I think at St. David's Foundation, they had been pushing their grantees to bill. And then they thought, oh, we're asking them to do something. We're not offering any assistance in how to do it. And that's kind of where the Capacity Building Academy came from, because their program officers internally saw a need. If we're going to continue to say, why don't you bill, we should be able to provide the support to help them do that. And they had a great return on investment by the end of the academy.
That's exciting. The more I hear you all talk and the more we dive into this implementation science stuff, the more I see it all time back to data and the story that we want to tell, and the story that organizations want to be able to tell about their work. And I just heard you talking about that too, Melissa, and being able to get beyond just the financial and the numbers, but like, what is the quality? What is it that we're bringing to the community? And I think that's such an important story that a lot of our audience is working to be able to communicate effectively. That's great.
Well, and if I just may add, we're also in the philanthropic world looking at what is called outputs, like numbers of people served, numbers of dollars coming in, difference in, those types of things, but also outcomes. How are you measuring a change in the service that you're providing to people? What difference does it make to people's lives pre-offering an evidence-based practice and then post-offering an evidence-based practice? That's very, very much in the philanthropic world, they're looking at that. I was talking to a couple of my colleagues in some different foundations, and they were talking about, we're funding the same things, same types of things year after year, but we're not seeing any changes. We really need to look at how are people really implementing some of these programs. So more and more funders are starting to really consider how is what each service provider is doing effectively helping the people they serve. And that's where data and measurement comes in. And that's why, for example, if you want to talk about, let's say, a collaborative effort from providers to get a billing academy to the Dallas area, I would probably ask St. David's Foundation, boy, could you share some of what happened from the time you started the academy till now, so that we can show the effectiveness this academy has been for the providers in the Austin area. And that right there, that's data, and that is something that can convince, hey, we know billing is good. It's a sustainable type of an effort, and it helps provide more services to people. Let's really think about getting this started.
Well, and Cindy, you just did a great job of teasing our next webinar, which will be about measurement-based care. So really showing more about the outcomes that you're seeing and not just the number of people that you serve. But we did have one more question before I go into full wrap up mode. Do you have any final recommendations, like readings or resources that you could share with our audience about how to maximize revenue and billing? You're really just looking for, thought leaders. Who should we be following?
I could put together a short list of books that nobody wants to read, but are really helpful. So I'd be happy to, I've got all kinds of resources, but let me think through what are kind of the high level get started resources, and I'll give that to you, Tegan, and you can share it with those that registered for today.
Excellent. I know we'd appreciate that.
Well, in the fundraising philanthropic world, there are a lot of different resources about how to find grants, how to get grants. I can't say there's any one thought leader, but the Chronicle of Philanthropy, which is it's a monthly magazine, although it's virtual now, and newsletters, talks about different types of projects across the country, and talks also about some of the effective ways that people are measuring how different foundations across the country are thinking about things, the change of thought, the change of process. So those are always good just to keep up on the sector of philanthropy itself.
So we can add that to our list, and we'll follow up with our registrants. So before I wrap us up, any final words? Are there any questions that we didn't ask that we should have asked? You all talked out. Excellent. Well, then on behalf of our team, I just want to thank you both for sharing all of this valuable information, your insights, your wisdom. We really appreciate it and find it super valuable. So I know I'm probably going to walk away with even more questions for you. So, so there's that. Watch out for that. And everybody who joined us, thank you so much for joining us on this webinar today. And again, look forward to our next webinar on November 3rd at noon. Again, this is where same time, same place. And we will have a session on measurement-based care. So we'll be following up on this with some really valuable information on how you can report more outcomes in your work. So thank you all again for joining us. Take care, and we hope to see you next time.